Most men are unaware that their penis ages alongside their heart, brain, and joints, and neglecting it can lead to more than just a loss of function. It can erode confidence, dignity, and the deep connections that define a fulfilling life. I'm Dr. James Carter, a urologist with over 25 years of experience, specializing in men's health, helping older men preserve their sexual vitality and sense of identity. What if the primary cause of penile dysfunction after 50 isn't aging but a lack of simple daily care? In this comprehensive guide, I'll share 6 essential, science-backed strategies tailored for men over 50 to protect their penis and prostate, enhancing both health and quality of life. These aren't quick fixes or fads, they're practical, sustainable habits that can transform how you feel, function, and connect. Stay until the end for a bonus tip most doctors overlook, one that could prevent a painful condition affecting countless older men. If you're ready to take charge of your health and vitality, hit subscribe and turn on the bell for more age-specific men's health advice. Type 1 in the comments if this resonates with you, or 0 to share how I can improve. Let's begin with a critical step that sets the foundation for penile health: prioritizing a healthy lifestyle. 1. Embrace a healthy lifestyle. Fuel your vitality. After decades treating men over 50, one truth stands out. Your lifestyle shapes your sexual health more than any pill ever could. Many men seek quick fixes, but no medication matches the power of consistent, healthy habits. Erections rely on robust blood flow, which depends on a healthy heart and blood vessels. Smoking, excessive alcohol, or a poor diet damages these vessels, restricting circulation to the penis and beyond. Erectile dysfunction often signals deeper issues, like heart disease, urging you to act before it's too late. The good news is, every healthy choice you make has immediate lasting impact. Quitting smoking boosts circulation within days. Cutting back on alcohol rebalances testosterone. Walking 30 minutes daily, or eating vascular-friendly foods, berries, leafy greens, fatty fish, or nuts enhances energy, function, and confidence. These habits don't just extend life, they enrich it, fostering deeper connections and engagement. I've seen patients transform by embracing small changes: better sleep, more laughter, and renewed intimacy with partners. Start with actionable steps. Replace one processed snack with fruit, walk after dinner, prioritize 7-8 hours of sleep, and stay hydrated. Keep a journal to track improvements in energy, mood, and arousal over 2 weeks. Complement with stress-reducing practices like meditation or yoga to support hormone balance. Your body isn't broken, it's responsive, waiting for you to nurture it with care. This lifestyle foundation fuels not just sexual health but your entire sense of self, setting the stage for the other care methods. 2. Prioritize proper hygiene. Clean the right way. Proper penile hygiene might seem basic, but after years in practice, I've seen countless men face infections, irritation, or serious conditions due to outdated or inadequate cleaning routines. As you age past 50, your skin grows more sensitive and your immune system slows, making it harder to combat bacteria or heal irritation. Hygiene that worked in your 30s falls short now, especially for uncircumcised men, where bacteria, sweat, and dead skin under the foreskin can lead to balanitis or increase penile cancer risk, a serious, growing concern worldwide. The solution is straightforward but vital. Wash daily with warm water and mild, unscented soap, avoiding harsh products that disrupt skin balance. If uncircumcised, gently retract the foreskin, Rinse thoroughly and dry completely to prevent moisture buildup, which breeds bacteria. Clean after sexual activity to remove fluids, lubricants, or sweat that can cause irritation. This 1-minute habit can prevent painful infections, odors, or severe health issues. Beyond physical benefits, proper hygiene boosts confidence and self-respect. Caring for your penis like you do your heart or appearance makes you feel cleaner, more in control, and ready to engage with life. Make hygiene a daily ritual, perhaps post-shower, using a soft towel for thorough drying. Pair with a moisturizer like aloe vera, if needed, to soothe sensitive skin. Journal your comfort levels over a week to reinforce this habit's impact. This small act of self-care strengthens your dignity and prepares your body for healthy function. 3. Stay sexually active, use it or lose it. I often hear men in their 50s and 60s say, "I guess my sex life is done." This belief that sexual function fades inevitably with age isn't just falsight, can cause decline. Your penis, like your muscles or heart, thrives on regular use. Prolonged inactivity reduces blood flow, weakens elasticity, and risks penile disuse atrophy, where tissues shrink and function falters. This is basic physiology, not a scare tactic. Sexual activity, including masturbation, isn't just for pleasure, it's for preservation. Regular blood flow maintains tissue health, oxygen supply, and erectile function, like exercising a muscle to prevent stiffness. If intercourse or solo stimulation isn't feasible, try pelvic floor exercises, Kegels, 10 daily, or medically approved vacuum erection devices to support circulation. The goal is to stay active, no matter your age or situation. This step preserves not just physical function, but your sense of identity. For many men, sexual vitality ties to self-worth, and losing it can dim confidence. Staying active, whether through intimacy or solo practice, reclaims pride and connection. I've seen men in their 70s spark a ripple effect by embracing this. Stronger intimacy, renewed motivation, and improved overall health. Start with 2-3 gentle sessions weekly, focusing on relaxation and sensation. Pair with zinc-rich foods, nuts, seafood, to support testosterone. Track progress in a journal, noting confidence or energy shifts. This isn't about youth, it's about honoring your strength now. 4. Limit pornography. Nurture real connection. Let's be candid. Adult content is more accessible than ever, and for men over 50, especially those single, widowed, or feeling disconnected, it can seem like a harmless way to stay engaged. But excessive pornography rewires your brain, training it to crave fast, visual, solitary stimulation over real-life intimacy. This desensitization dulls responses to physical touch or emotional closeness, leaving men confused and isolated. Patients in their 60s have shared, "I have desire, but my body doesn't respond with my partner." Often, it's not physical but psychological conditioning from porn overload. Beyond arousal, excessive use fosters shame, loneliness, and low self-worth, eroding confidence and relationships. Moderation is key. Use porn sparingly, if at all. Rebuild natural arousal through memory, imagination, or emotional intimacy with a partner. Invest in foreplay, open conversations, or shared activities like cooking or walking to rekindle desire. Limiting porn isn't about denying pleasure, it's about reclaiming it meaningfully. Reduce use to once weekly, replacing it with sensation-based activities like mindful touch or reading. Journal emotional and physical responses over 2 weeks to track progress. If needed, seek a counselor to support this shift. This restores harmony between body and mind, enhancing real connection and vitality. 5. Avoid intimacy with a semi-erect penis. Prevent long-term damage. This may catch you off guard, but a frequent issue I see is men injuring themselves during intimacy by engaging before they're fully erect. In the heat of the moment, it seems minor, but penetration with a semi-erect penis causes microtraumastiny, internal injuries that build scar tissue over time. The penis is a delicate network of blood vessels, spongy tissue, and smooth muscle, and without full rigidity, it's vulnerable to pressure. These injuries can lead to Peyronie's disease, a condition causing painful penile curvature that may hinder or prevent intercourse. Many men delay seeking help due to embarrassment, only to face advanced scarring that limits treatment options. The risk stems from lack of awareness, not recklessness. Slow down and wait for full erection before intercourse, using lubricants to reduce friction and ample foreplay to build arousal naturally. Communicate openly with your partner to avoid rushing, and allow erectile aids to take full effect if used. This cautious approach safeguards comfort and confidence. Practice 10 daily Kegel exercises to strengthen erectile support and track arousal patterns in a journal. Pair with relaxation techniques like deep breathing, 4 seconds in, 6 out, to enhance readiness. By respecting your body's needs, you ensure intimacy remains enjoyable and pain-free, preserving function and connection. 6. Support prostate health. Monitor and maintain. Prostate health is inseparable from sexual health after 50, yet many men overlook it until symptoms arise. The prostate, a walnut-sized gland, supports ejaculation and urinary function, but aging increases risks of enlargement, BPH, inflammation, prostatitis, or cancer. Neglecting it can lead to urinary issues, erectile challenges, or discomfort that dims confidence and intimacy. Regular checkups with a urologist, starting at 50, are crucial. A PSA blood test and digital rectal exam can detect issues early. Maintain prostate health with dietite foods rich in lycopene, tomatoes, watermelon, and omega-3s, salmon, walnuts. Stay active with 150 minutes of moderate exercise weekly, like brisk walking or swimming, to reduce inflammation. Avoid prolonged sitting, which pressures the prostate, and practice Kegels to strengthen pelvic muscles. I've seen men regain comfort and confidence by prioritizing prostate care, avoiding complications that disrupt life. Schedule annual screenings and track symptoms, urinary frequency, week stream, in a journal. Pair with hydration, 8 glasses daily, and limit caffeine or alcohol, which irritate the prostate. This proactive approach supports sexual function, urinary health, and overall vitality, reinforcing your sense of control. Bonus tip: sleep without underwear. Enhance nocturnal health. This might seem minor, but small habits yield big results. Sleeping without underwear in loose boxers supports your body's natural repair during sleep, including nocturnal penile tumescence, spontaneous erections that oxygenate erectile tissue. Tight underwear compresses the penis during these erections, risking irritation, reduced blood flow, or scarring that contributes to Peyronie's disease, a painful curvature more common in older men. Sleeping nude or in breathable clothing allows freedom for these processes, reducing risk and enhancing comfort. Patients report stronger morning erections and improved confidence after adopting this habit. Try it for 2 weeks in a cool, well-ventilated bedroom, noting changes in comfort or function in a journal. Pair with a lightweight cotton bedsheet for breathability. This simple adjustment bolsters penile health and underscores your commitment to self-care. Conclusion: reclaim your dignity, confidence, and vitality. Your relationship with your body evolves with age, and how you care for it now matters more than ever. The 6 steps embracing a healthy lifestyle, maintaining hygiene, staying sexually active, limiting pornography, avoiding semi-erect intimacy, and supporting prostate health plus the bonus tip of sleeping without underwear are acts of self-respect. They reinforce your dignity, vitality, and connection to your identity as a man. I've helped countless men rediscover confidence, not by chasing youth, but by choosing care, engagement, and wisdom. If you've been struggling silently, you're not alone, and it's never too late to start. Pick one step today, perhaps a daily walk, thorough hygiene, or a porn-free evening, and build momentum. Journal your progress over a month, tracking physical, emotional, and relational shifts. Share this journey with a partner or friend to deepen connection and support. Your health reflects your attention, shining through in how you move, love, and live. Like, share, and comment 1 if this inspired you, or 0 for suggestions. Subscribe for more honest, practical men's health conversations. Stay tuned for my next video on natural ways to boost vitality and prostate health after 50 no gimmicks required. Your best years are still ahead. Claim them with strength, wisdom, and purpose.